I am so excited to introduce our community today to Rick Olderman. He is a sports and orthopedic physical therapist for more than 25 years. He's had this experience and specializes in helping people with chronic pain-free experience and a pain-free life, which, my goodness, so excited to pick your brain on this today. Welcome, Rick.
Thanks for having me. I'm excited to be here. Lots to talk about.
So much to talk about. And I was actually going to throw this your direction first, and then we'll just run with the rest of this. But the way that I think about this is we have things like pebbles, rocks, and boulders, these little things that might be affecting us in our life, the bigger things. And then there are these, I'm going to call them boulders, where we're like, if I don't fix this, it affects my entire quality of life. I am no longer living as the human that I want to be living as. And I really view pain as one of those topics. And that's what we get to talk to you about today. So introduce yourself, let us know your history, and then we'll go from there.
Oh, sure. Well, you said most of my history already. I'm basically a physical therapist of over 25 years. The reason I ended up specializing in chronic pain is because there's so much of it around. And really, when I first graduated from PT school, I was a failure at helping people with chronic pain because
Hmm.
the tools I was given in PT school didn't apply to chronic pain. You have to look at the body differently. This is why we have chronic pain, I believe. And it's not only in physical therapy school, I think it's in medicine in general, chiropractic, massage, whatever. We are taught, we look at the body as components. And so, oh, you've got shoulder pain. Let me do 5 different tests to identify the specific tissue that's damaged, and then we'll treat that tissue, and you'll be good to go. So we have 1,000 different tests to identify pain or sources of pain. We have X-rays, MRIs, and all these orthopedic tests, but we have 0 tests that identify why that pain is occurring. So that we can identify the tissue that's damaged, but not why the tissue is damaged. And that is what is needed to solve chronic pain.
And I'm loving this already because you're right. It transfers over into everything in life. I'm a dietitian. I feel like food too. If we don't address all the onion layers underneath why we're struggling with weight or why we're struggling with autoimmune or whatever that looks like, then everything's temporary. Everything's a temporary band-aid fix. And it was interesting that you said I was failing. Like you came out probably super excited to use what you've just learned through all of your hard-earned years of college and after. And then there was that frustration. So what did the path look like for you to get to where you were finally like, now I'm making a difference?
Yeah, well, there was a significant amount of depression and anxiety associated with that failure because, like you said, I spent a lot of years studying, a lot of money studying. I really thought this was what I was supposed to be doing, and only to find that I couldn't do it. And I thought that was my fault. And I'm happy to accept as much responsibility in that area as necessary. But I started out at a small rural town in Colorado with only 1 or 2 physical therapists. I was ashamed to go out in public because I was a failure, because I thought
Hmm.
everyone was saying, oh, well, that's the physical therapist that couldn't help me. That guy doesn't know what he's doing. So then I eventually moved to Denver, and I went to work at an elite downtown athletic club. I was the only physical therapist on staff. They had never had a physical therapist on staff. And instantly my schedule filled with people with chronic pain issues. These are people in their 20s through 70s, well
Hmm.
to do, big career people, real intelligent, great health insurance, had been to everyone that they could be in Denver, and still had chronic pain. And I'm just like, that's when it started to dawn on me that, oh my gosh, this isn't just my fault. In medicine, we don't do well in general with chronic pain. I had no idea. I thought I was supposed to be given all the tools to solve chronic pain in school. So ultimately, what I always believed was that something that I'm doing, because I had chronic back pain prior to all of this, something that I was doing was causing my pain. And I felt that something that all these people who have chronic pain, something that they're doing is causing their pain. And so then I had to think, well, what instructor, because I wasn't trained like that, right?
Hmm.
So I thought, what instructor teaches about movement and pain? And that then Dr. Shirley Sahrman's name came up. She's a PT PhD out of Washington University in St. Louis. She's been there for decades. She's written 2 textbooks, one translated into 7 languages. She's like brilliant. She uses the doctor's rehab and anatomy concepts over there. So she's just so smart. And I took all of her courses. And that's when I finally found these connections between movement and pain. And I started seeing great success with my patients. But as what happens in medicine is the next layer of patients starts knocking on your door. And these next layer of people, well, I could help them somewhat. I couldn't help them all the way. And that's when I thought, I've got to look elsewhere to find out what's going to help these people. And that's when Thomas Meyer's book, Anatomy Trains, I discovered that. And that's about fascia, and that we have these super highways of fascia running through the body from head to toe. And so that helped me see things further away from where the source of pain was that could be contributing to that pain. And then finally, the next layer of patients knocked on my door. And these people seemed to have like a battery inside their body that was charging them to assume these patterns of dysfunction that I was discovering, right? I could correct the pattern, but the next day it would come back again. And it was like they were trying to be in these patterns of dysfunction. And that's when I discovered Thomas Hanna's work with Hanna Somatics. And he studied neurological patterns of pain that cause our pain. Well, the interesting thing about Dr. Thomas Hanna, Dr. Shirley Sahrmann, and Thomas Meyer's work is they all identified the same 3 patterns of dysfunction, all from completely 3 different sources or points of view of studying the body. And when I saw Thomas Hanna's work, I'm just like, oh my God. And then I could put it all together. Now I had it. I had the biomechanics, I had the fascia, and I had the neurological aspect of it all. And that's when I really started, things just went through the roof at that point. It was just amazing. So that was my journey.
Oh, this is so good. And now I'm going to make you backtrack for a second.
Sure.
Okay, let's take that layer 1, that first layering of clients where you felt like you were getting some success with them. Give our listeners an idea of what they were walking through the door with. And you mentioned movement, like how movement was helping them.
Yeah. So by movement, what I mean is how we're using our body. Let's just talk about back pain for a second. And those of you listening, I'm holding up a skeleton right now. So it might be beneficial. I'm going to be using the skeleton to describe some things. So you might want to jump onto the YouTube channel to watch this. But anyway, one of the most common patterns of pain causing almost all back pain is that of excessive arching of the low back. And you can confirm this if you're lying on the floor with your legs straight and feel what your back feels like there. And then bend your knees so your feet are flat on the floor, so your back is flatter to the ground. 99% of the people will say, oh yeah, my back feels a lot better when my knees are bent rather than when their knees are straight. So what that's telling you is that, oh yeah, my back feels better when it's flatter. Well, it's not so much about the back being flatter that matters. It's about what things are trying to pull it into too much arch that really matters. I mean, easy to flatten our spine. We just tuck our butt underneath us and walk around like this, but it looks like you have to go to the bathroom all day, right? It's an unnatural way of solving things. So better to eliminate the forces that are trying to pull the spine into an arch rather than just artificially cause the spine to flatten. Okay. So where does movement come in with this? Well, one of the most painful activities for most people is to bend down and pick something up. That's when most people are throwing out their backs. Well, most people do that by bending over, keeping their back arched. And then when they come back up, they keep their back arched, right? So they're reinforcing this arch pattern that we've already identified is the thing that's causing their pain because of how they're bending over and picking things up or getting up from a chair or walking and so forth. So all of these activities are promoting more arching in the spine because of how you're doing the activity. For instance, if your listeners stand up right now and they lock their knees back, they'll notice that their back arches more when they do that. And when they unlock the knees, their back arches less. So if you lock your knees when you're standing and walking, then you're contributing to the arching of your spine. And the arching of the spine is what hurts your back. That's how movement habits create pain. Does that make sense?
It makes total sense. And what about the person who goes, I hear you. And then they also feel like, do those small adjustments actually make a difference? Like, do you get a lot of kickback on Okay, maybe, and then they don't go change it. So then they don't get the reprieve or they don't believe that it could work.
No, I get almost no kickback. Why? Because I proved that it works in the clinic. So
Mhm.
that little test of lying on the ground and then
Yeah.
with legs straight versus knee, I explained that. Do you see now that your back feels better when it's flatter? Oh, yeah, that feels a lot better. In fact, my back hurts more when I'm standing. Maybe that's why it hurts more when I'm standing versus sitting, is because my back
Mhm.
is more arched when I'm standing. Oh, I get it now. Okay. Well, you locking your knees is one of the things, and I take them through what we just did. When you lock your knees,
Yeah.
your back is more arched. And when you don't, your back is less arched. Let's just try this for the next 3 days. And what I do, one of the little tricks I've learned is that I put a little piece of tape behind their knees so that whenever they lock their knees, it gives them feedback that they're arching their back because these are unconscious habits.
Mhm.
People don't
Mhm.
understand that they're doing them. And so you need a reminder often to show you that you're doing them and to show you that when you don't do them, you feel better. So case in point, I had a woman, Division I swimmer, scholarship, elite swimmer in the nation, had to drop out of her program because she developed back pain. No one could solve it. 15 years later, she walks into my clinic and she comes in and she's seeing me for plantar fasciitis, not back pain, because she had completely given up that anyone could solve her back pain because all of these elite trainers, doctors, whatever, the whole team, no one could
Yeah.
solve it at college or anytime after. Well, she was in so much pain, I couldn't even evaluate her. And she came over and she would have to stand and like close her eyes, and recover from just walking to my table. And then when I asked her to sit, she would have to recover from sitting. And then when I asked her to stand, she would have to recover from that too. I'm just like, gosh, that plantar fasciitis is really bothering you. She says, oh, that's not my plantar fasciitis. It's my back, but you can't help me. No one's been able to help me with my back. And boy, nothing gets my hackles up more than someone telling me that I can't help them. So she was in so much pain, I couldn't even evaluate her. But I had seen all I needed to see just by how she walked over to the table. And I said, look, we're going to put these two little pieces of tape on the back of your knees. And we're going to see what happens when you stop locking your knees for the next 3 days. She came back 75% better in 3 days. And not only her back pain, but also her plantar fasciitis. It's all connected. And so
Mhm.
this is how you get people to buy in. And this is what a lot of physical therapists tell me is, I can't get my patients, my compliant rates is so low. Well, that's your fault. You haven't shown them that what you're doing is solving pain. What a lot of physical therapists and chiropractors and doctors or whoever are doing is throwing a bunch of exercises at someone, wondering if they're going to help them. Well, by the time they get to my clinic, people have these thick books full of thousands of exercises they've been told to do. They're doing them for hours a day. They're not helping them. And they're just like, this is why they've given up. And so that's why we have to just, hey, let's throw all that out. You see this little pattern? This is something that we're going to solve right now. And this is how we're going to do it. And so you got to show them that whatever you're doing is causing pain and fixing pain.
Well, I think the really cool thing about this is that the tape behind the knees example is something that they can walk around with them all day and keep remembering and keep working on versus trying to carve out that 20 minutes to go do exercises. And I know that's what you were starting to talk about is that's the non-compliance part. It's trying to figure out how to habit stack enough to like fit in the 20 minutes here and there. And your way is making it just flow into their day, which is huge.
Yeah.
So,
I don't count those as exercises because we're just changing how you use your body. It takes
yeah,
no extra time out of your day.
right. That's a big deal. That's a game changer right there. Like if we talked about nothing else to
Yeah.
even know, because, okay, so that's an example with back. Do you have those little tricks with everything? Like somebody comes in with neck pain or somebody comes in with shoulder pain. Is that body positioning for the most part as well?
Yeah. So it's important to understand that these aren't like a really popular term to use nowadays is called hacks. Oh, I'm going to do a little biohack, for this. These are not tricks. These are actually come from fixing how you're using your body. So
Yeah.
unlocking the knees is how you should be using your body. Rather, a trick is like, oh, I'm going to do something that, we're going to fool you. No, there is no fooling. This is the way it should be working. So
Yeah.
all the things that I use are based on a deeper understanding of how our body is supposed to be functioning. So yes, there are lots of different things I do because ultimately all of our pain is due to how we're using our body, right? So I have lots of those little tricks to solve pain all over the place because we're fixing the mechanics of how you're using your body ultimately. And ultimately, like then after 3 days, for instance, the tape on the back of the knee, you don't need that tape anymore because now your brain has changed. It recognizes that this change in your movement is fixing your pain. Now I don't have to convince you anymore to do it. Now you'll start noticing when you're not doing it instead.
Mm-hmm. Mm-hmm. Do you feel like you're so trained with watching people that like pretty much somebody just walks through your door and you can almost give them exactly their mechanics that need changed?
Oh yeah, I do this.
Yeah.
My family hates to walk with me at the mall because oh, look at that anteverted femur. Oh, look at that side bending problem over there. I bet you that person. And then I just go and they're just like, get away from me, stop. And
God,
I can't
stop.
turn it off. I can't turn it off because I constantly
Uh,
see all of this. It's like, I see pain. So anyway, yeah, it's something I can't turn off. And and once you learn this, anyone can spot this in anybody. I don't have any special skill. I just have a lot of practice in it. But anyone
yeah.
can learn how to do this.
That's all right, and we'll move on. But I agree with you. Once you're very aware of something, I saw a text neck picture of like how our vertebrae goes when we're looking down on our phone, and you watch people everywhere, and they're all in that form. You're like, oh
Yeah,
boy.
I'm glad you brought that up, Lindsay. A lot of people will say this is why you have neck pain. It is not why you have because you're looking down at your phone is not why you have neck pain or that you're
Mhm.
doing it a lot. Because I mean, if you look at our ancient history, we're always looking down at something because our hands are in front of us, right? We're
Yeah.
working on
No.
something in front of us. So looking down at something isn't the reason why we're having pain. We can go into the reasons why people have neck pain and headaches if you want to, but that's see this is another one of my little issues is that a lot of therapists will blame something that we can't possibly change on pain. So for instance, looking down at you're looking down at your phone, so that's why you have neck pain, or you have a weak core, this is why you have back pain, you're too heavy, or you've got this little spondylolisthesis, so that's why, and we can't change that. So you have disc bulges in your neck, so you can't change that, or the shape of your neck is wrong. So we come up with all of these excuses of why people are having pain, and they're all things that person can't possibly fix. And that excuses the therapist from solving the pain because they've chosen something that someone can't change to blame it on. And it's usually not the case. So I feel sorry for those people who feel that they're broken as a result. And you're not broken. You just haven't had the right information.
Yeah, thank you for saying that because I feel like one of the things that I always like to ask with experts like yourself is like, have you ever seen a hopeless case? Is there ever somebody that you've been like, I cannot help you?
Well, it's funny. I have this new book called Solving the Pain Puzzle out. All right. And the very last case study in that is someone I couldn't help. And so you'll see everything I went through to solve this person's pain, but it still did not help her. And so that doesn't mean that I don't believe that her case is hopeless. It means that I believe that we're not looking in the right place. And I couldn't get one of her doctors, I believe, to look more deeply at a particular problem that I think exists in her that I can't solve. And you'll know why if you read the story. That's not
Okay.
my purview as a physical therapist to solve this kind of problem. You have to be a surgeon to solve this problem, and I can't get someone to really look at it more deeply. But so yes, there are people who I can't solve using my techniques, but those people are the people who typically have a structural problem in their body that is, we can fix all the mechanics around that structural problem. And in most cases, that will solve the pain, even if you do have a herniated disc, a spondylolisthesis, spinal stenosis, things like that. But in those people that it doesn't solve, it means that the structural problem is the trump card in that equation. And we have to
Mm,
solve that.
yeah, no, that makes a lot of sense. So I was thinking about this. I want to hear about the fascia and then the neurological aspect. And maybe that'll be our good wrap up point. And for anybody who would like to join us for part two of this talk together, because there's so much in here, I don't want people's brains to melt. But I know that listeners are going, wait, I want to hear more about the plantar fasciitis. Wait, fibromyalgia, or people who feel like they stretch all the time and they're still super tight, like they can never get out of those tight feelings. Can we promote this for part two and come back to the fascia right now?
By all means. And we can get into leg length discrepancies, sciatic pain, neck pain and headaches, all sorts of things. We haven't even touched the surface yet.
No. Can I have you for the next 8 weeks?
Yeah, of course.
Yeah. Okay, so I was introduced to fascia. I have another physical therapist friend who I had like my aunt even flew in from Florida to Ohio. She knew this particular therapist did fascia release. And it's not a common, like a lot of people don't even know what this is. Can you please break this down and describe why this should maybe make somebody's ears perk up?
Sure. So fascia is the thing, it's the glue that holds our whole body together. So it connects muscles to muscles, muscles to bone, nerves to muscles, blood. It holds blood vessels in place. It holds our guts in place. It surrounds and invests everything, even into a cellular level. So it can become very microscopic. But as I mentioned in Thomas Meyer's book, he identified these superhighways of fascia that are running through our bodies from head to toe. And so these superhighways, there's one runs along the back. So we have a back line. It runs from the top of the head all the way to the bottom of the sole of the foot. That's the back line. He identified a side line along the side. He identified a spiral line that spirals through the body. He identified a front line and a deep front line that goes to the front of our bodies. So the reason that this is meaningful is because you can dissect this tissue all as one contiguous piece of tissue from the head to the foot. So we can dissect it and it's all connected. This is very different than how we're taught in PT school. We're taught that this triceps is here, this biceps is here, this hamstring is here, and there's no real functional connection between all of that. But Thomas Meyer's work shows that there is. And so it's very meaningful. And so fascia is laid down. There's a certain type of fascia that's laid down in areas of mechanical stress in the body. Well, mechanical stress in the body occurs, for instance, in the spine when there's a change of one curve to the other, like the cervical curve curves in and then it curves out for the thoracic curve, and then it curves back in for the lumbar curve, and then it curves back out for the pelvic, sacral curve. So these changes in curve points are points of natural mechanical strain. And so there's a type of fascia that's laid down there called myofibroblasts. Myo means muscle. It has 4 times the contractile capacity of normal fascia. All right. So so it's laid down thicker in these areas. So in times of emotional distress and so forth, we release something called cytokines. And cytokines circulate through our body. And what they do is they trigger the myofibroblasts to contract. And so that's when, if we have stress, emotional trauma, anything like that, and also allergic reactions to dietary issues, molds, allergens, all sorts of things like that, they cause an inflammatory response in the body that migrates to the areas that we have myofibroblasts more because they react to these cytokines. That's why when we're stressed, have trauma, or are not just feeling good, that's when the areas of our body are feeling worse, is because those areas are likely getting activated. So that's fascia in a nutshell, if that makes sense.
It does. And now I feel like our listeners need to understand that there's a therapy around it. Do you do myofascial release?
No, I don't personally do myofascial release. And the reason is because what is causing the fascia to be tight in the first place is how we're using our bodies. So I do myofascial release by fixing mechanics and movement patterns. If you fix how you use your body, for instance, unlocking those knees, you can imagine the knee locking is part of that whole back line of fascia. So if we unlock a part of that line of fascia, it unlocks the whole rest of the fascia like a spider web. So this is how I do myofascial release, is by fixing the body so the fascia doesn't become tense in the first place.
Hmm. Okay. I'm loving. I can go to bed after this podcast interview because I'm learning so much. Okay, go into the neurological piece of this.
Sure. So this is the really fascinating thing. Thomas Hanna identified the same three patterns of dysfunction that Thomas Myers identified and Dr. Shirley Sahrmann identified. And so we're born with these primal reflex patterns. One is called a Landau reflex, and that helps us lift our head. If you see a little baby crawling, you'll see that their back is arched and their head is lifting to look where they're going. And when you see a child learning to stand up, their head looks up and their whole body is in this arched position, right? So they're tapping into a broad reflex pattern that occurs along this back line of fascia to allow our spine to be tall and our head to lift. All right. Now, this back line of fascia and neurological pattern is also tapped into when we're under stress or emotional trauma. For instance, when we have to be super alert, right? We stand up really tall, our eyes get big, our head comes up, we're looking around, right? If you're in danger, your knees lock, you get as tall as you can to survey what's going on around you. So these deep primordial reflex patterns we're born with are overridden, though, by our prefrontal cortex, because we can't go through the day reflexively responding to every stimulus that occurs, right? We have to override a lot of that stimuli. Only the most egregious things get through and we trigger our patterns, all right? Thomas Hanna identified a technique to reduce the tension pattern that's set up along these larger reflex patterns that are causing almost all pain. It's called Hanna somatics. And so what he's basically releasing tension patterns along these fascial patterns and along the biomechanical patterns that Dr. Sahrmann identified. So why is the tension being set up in these patterns? Well, because of emotional, psychological trauma, because of inflammatory response from things that we're ingesting, or from how we're using our body that is continually re-engaging that line of fascia all the time, which then causes it to become more contracted. Because if you're going to be doing, let's say, biceps curls all day long, well, then your biceps is just going to not relax. Why should it relax if all you're doing is contracting it all day long? Your brain will learn just to keep it turned on. Same with any muscle in your body. If you don't ever go through and allow something to shut off, then your brain's going to say, oh, that's how you want to be? Okay, great. I'll just keep it turned on all day long. No problem. All right. And that's why these patterns are getting engaged throughout the day, is because of how we're using it, emotional trauma, or things that we ingest that's engaging this pattern of dysfunction. So Thomas Hanna identified, he teaches a technique to release this pattern, and the front pattern. All right. So it's been very powerful for solving chronic pain, because if someone has chronic pain, it usually means that they have a larger pattern of issues that's feeding their pain right here. Right. Mm-hmm. And so the somatics allows us a way to reduce tension along that whole pattern to reduce pain here. Does that make sense?
Okay. Yeah, it does make sense. And I feel like the answer is going to be too long for today, because even to just say that if it's food, if it's somebody's inflammatory issues going on, then that might be a whole nother cycling of like investigation, I guess. It's a long process, and it should be. Like, it was probably a long process to get to where people are, and it's a process to get back out of it. But do you send that client out the door going, hey, I think that this is what we're dealing with. I'd recommend going and investigating here. Like, how does that look in your office?
Oh, that's exactly what I do. So when you work from a system standpoint, which is what I work at, instead of this component thinking standpoint, I expect results very quickly. If someone isn't 30 to 50% better in 2 or 3 appointments, that means that there's something, I'm either looking at the wrong thing or there's something else feeding this issue. Because when you fix systemic problems, like what I
Hmm.
do, you see a very rapid pain reduction. This allows me to move on to other problems very quickly. And if I've worked through all of the things that I've identified and it's been like, say, 4 or 5 visits and I'm not getting where I should go, then I start
Hmm.
to suspect, oh, do you have a dietary issue? Are you allergic to gluten? Have you ever checked this out? Or I'll just frankly ask them, do you have a history of anxiety or emotional depression in your,
Hmm.
and almost everyone's just like, how did you know? Well,
Uh,
your body is telling me that
uh-huh.
something is locking you in this pattern. It's not the biomechanics. It's something
Right.
else.
Yes, no, great answer. And this is a great time to inform our audience that the good news is you have a lot of books out in the world. And my guess is the purpose is because the answer is often the same, right? Like you could really direct people to different books who are asking similar questions. I'm guessing. Tell us about your book series.
Yeah. So I've just recently come out with this book called Solving the Pain Problem. And so
Hmm.
these are cases from 25 years. This is how I use this information to solve people's pain, pain that no one else could solve. So I think it's my previous books. I wrote 6 other books, and those are self-help books about how to solve your pain. Those were written about 10
Hmm.
or 15 years ago. Those identify the anatomy, biomechanics. We go through the muscles and things like that, and exercises to fix pain. But over the years, I've gotten a lot of feedback from people who really identify with certain people that I wrote about in those books, and they wanted to hear more about those people. So
Hmm.
this is kind of flipping it on its head. I'm talking about the people and how we solve their problems rather than getting deeply into the anatomy, biomechanics, and so forth. For those of you who, I'm not good with anatomy and biomechanics, I don't want to learn all of that stuff. This is the
Uh-huh.
book that will introduce you to the idea of a systems approach as opposed to what you've been working with, which is a component approach, which is why you're still having pain.
Right. Oh, thank you. Okay. And where is the best place to find your book as well as you?
Well, my book is on Amazon, so you can order it there. Solving the Pain Puzzle. You can find all my books on Amazon. Just type in Rick Olderman books, and they'll all come up for you. And my website is rickolderman.com, where I have free chapters from this new book that you can read. I have an ebook. I have my downloadable home programs to solve chronic pain. I even have a practitioner's program to teach practitioners how to do this, how to look at the body like this to solve pain too.
Awesome. 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 And so any listener who's going, I want more, again, we're going to come back in a part two and address more specifics such as plantar fasciitis. And what else do we want to talk about just so they know what we're
Gosh,
going
leg
into?
length discrepancies, one of the biggest myths in medicine, sciatic pain, SI joint pain, neck pain, headaches, shoulder issues. We can hit it all.
Okay, we're going to hit it fast and hard in part two. So join us. And Rick, thank you so much for coming on today. I appreciate it.
Absolutely my pleasure. Thank you.